Hello and welcome to part 1 of Addiction and its Treatment. It's really for anybody who would like to know some more about the condition of addiction, and indeed for counsellors who don't have specific training or experience in this particular area. The first thing I'd like to say is that in the United Kingdom, addiction falls under the Home Office. Now what that means is that it's seen by government as a criminal or a moral issue, really rather than a health condition. Thankfully, there are some people campaigning for change in this area, and perhaps the most notable of these is the entertainer Russell Brand. What I've encountered as a therapist working in addiction are people filled with denial, shame, guilt, and self-loathing. These are people for whom taking a substance, including alcohol, has become a form of self-medicating. What they're trying to do is to numb or blot out pain of some description. And that pain is often buried in the unconscious until it's uncovered in the treatment. I need to say at this stage that I have only worked with addiction to substances, and also I come from an abstinence-based philosophy around recovery from addiction. So, what can people become addicted to?
These are just some of the substances and events people can become addicted to. I'll mainly look at substances because that's my particular area of knowledge and working experience. And that list is by no means exhaustive. It's important to say that while treatment may vary slightly depending on the addiction, the psychology is exactly the same regardless of what the substance or event is. While there are physical consequences, addiction is a mental health condition. I've included here a sample of the kinds of people I've worked with in addiction treatment, really to get away from the stereotype of the person on the park bench. That person is there because their financial circumstances dictated it in the first place, or because the addiction has progressed so far that they've lost everything. And again, that list is by no means exhaustive. So, how do we begin to understand addiction? Well, there'll be a preoccupation with the substance, getting hold of it, the ritual around taking it, the way in which the mood is altered, and recovery from the episode. And this preoccupation will be going on even when the person is engaged in other activities like work, school, a day out with the family, whatever it happens to be. Control over the substance and where it takes them is lost. Somebody might intend to go for a couple of drinks with friends, but if they were able to face reality, they would know that they are really not in control of what might follow. They'll continue despite any negative consequences, and I actually worked with somebody who was still convinced they could control their drinking, despite the fact that they were waiting to be put on a list for a liver transplant. And the thinking is irrational and distorted, and defense mechanisms are employed. The main one, of course, is denial, but there are also others, like rationalization. Addiction is a chronic condition, which means it's lasting, unlike some physical conditions which are acute, and when treated once, they're gone. It can be arrested and managed, though, but maintenance of recovery and relapse prevention, to one degree or another, are ongoing. An addiction is also a primary condition. By that I mean whatever might have contributed to its development, the addiction has now become a separate condition in its own right. If, for example, someone developed alcoholism while alleviating social awkwardness, there would be no point in helping them to become socially adept, because they'll still be left with the addiction. You really must treat both, and the addiction treatment must come first, certainly in the early stages of recovery. It's also a progressive disease in that it gets worse over time, and if not arrested and managed, it'll kill. Increased tolerance means the person will need more and more of whatever it is over time to get the same effect. In tandem with this process, the mind and the body will continue to become more and more damaged. In abstinence-based recovery, addiction is seen as incurable, because if somebody uses a substance again, the act of addiction will be triggered, and it'll only be a matter of time before they're in a worse condition than where they left off. Now, there are some people who would argue with this, but all I can say is in all of my years working in addiction treatment, I have never come across anybody who was able to revert to becoming a social drinker or user without reawakening the addiction. I see addiction as a parasite that takes over the self. The core of the person, or if you're familiar with psychology terms, the organismic self, is engaged in a battle with the addiction. The addiction wins, and this results in shame, guilt, self-loathing. And because these feelings can be overwhelming and difficult to experience, the defense mechanisms kick in, such as denial, rationalization, and perhaps some others. The person may present as self-serving, selfish, arrogant, but on a deeper level, they're lonely, fearful, and lost. I've included some questions here to ask to help ascertain whether or not somebody is in an active addiction. As you can see, I got them from the American Psychiatric Association, and you might want to look them over a couple of times to get the gist of them and put them into your own words, into your own language. They're basically to test any preoccupation, attempt to stop, development of tolerance, and whether the use of a substance has prevented the person from engaging in activities like work or hobbies or family life that they would ordinarily have taken part in.
Well, I hope you found that interesting. In part 2, I'll take a look at what detoxification, or what we know as a detox, means, and what addiction treatment might look like. I hope it's been of some value, and that I'll see you soon again. Take care.